Welcome to Cape Town Conversations 2024, our studio session on healthcare resilience. So in the context of COVID-19 pandemic that has exposed the critical gaps in the healthcare system, underscoring the need for resilience and innovation, we have two experts here today who will be talking about lessons learned and strategies to integrate innovation, ensure equitable access, and foster international collaboration for global health security. We'll start off and I will just introduce both of you. We have Ms. Swabhavika Singh, who's a public health medicine physician at the University of KwaZulu-Natal, South Africa. And we have Ishita Barua, who's the co-founder and chief medical officer of Live Health in Norway. And I myself am Vanshika Kant. I'm a climate, human and social development expert with the Asian Development Bank. And I focus on the climate and health intersection in particular. So thank you for joining today. And as a starting question, I'd love to know from the both of you that what are some of the critical lessons on preparedness and response that have emerged from the pandemic, and how can they guide us to prepare better for future healthcare crises?
So I can start. During the pandemic, frontline healthcare workers worldwide, they faced immense challenges. So from grappling with limited knowledge about the virus to managing resource shortages, the early days of COVID required quite a lot of rapid improvisation. Now, I worked in primary care at that time, welcoming patients with COVID-19 symptoms, and our role was to manage uncertainty, provide care, and protect the most vulnerable. Now, there are two critical lessons that I would like to highlight. One of them is, while many countries implemented stringent measures like lockdowns, these interventions often lack the accompanying rigor of scientific evaluation. So for instance, few nations used the opportunity to conduct randomized controlled trials to assess the efficacy of interventions like school closures, mask mandates, social distancing in general. So this left policymakers with limited evidence to guide decision-making during subsequent waves or future pandemics. Now, another crucial lesson that I would like to highlight is the importance of scrutinizing the technologies that we adopt during emergencies. For example, a study published in JAMA Internal Medicine in 2022 highlighted racial and ethnic biases in pulse oximetry devices. So these devices overestimated arterial oxygen saturation levels in Asian, Black, and Hispanic patients compared to white patients. Now, this systemic bias contributed to delayed recognition of eligibility of oxygen therapy among affected groups, potentially worsening the outcomes. Now, this serves as a very sobering reminder that while technology can be life-saving, it must also be rigorously tested for equity and effectiveness to avoid perpetuating disparities.
From my point of view, when I look at health systems and health system strengthening, we go back to the WHO's health system building blocks. And I think at the forefront, when we look at governance and from a global level and where we actually drove this, we need to have looked more at a more trusted multilateralism, and we needed to look at our communities at the center of that, where our patients were co-creators. This was something that was very novel, and it was very acute and sudden. And there was a lot of information. And as a result of that, there was a lot of information which was filtering down. But what may work in high-income countries don't necessarily translate to low to middle-income countries. And the low to middle-income countries, which were previously underpinned by historic underpinnings where there was restrictions and we don't have as much resources, it became that global north and global south divide. And as a result of that, that governance and that trust and that solidarity was missing. We saw it with vaccine nationalism as well. We saw it with the hoarding of PPE, with testing kits as well. So I think from that point of view, it is on a global level that global governance needs to look at equality and equity and how we bridge that gap. We're seeing it currently now in Africa, where we have an mpox outbreak, where it's a public health emergency of continental concern. And we see when there's a political divide, or where there's something strange, or not strange, but something that's occurring politically, like if we look at the US elections that just happened, what was the first call from the AU was, please let us have the vaccines that were promised. And so when we look at it from that point of view, we have to put communities and we have to put the global south on a even par and a standing as well. We have to look at equity. So that is just from a global perspective. On a service delivery perspective, I think what we saw was our essential health services which fell away. It was the pandemic which was in the spotlight, and everything that came afterwards had to be halted. And that cannot occur because HIV, TB, antenatal care, maternal child health, NCDs especially, which was also together with a risk factor during this COVID-19 and worked as a syndemic, was now put on hold. And therefore, it's essential that we have our essential services which still occur. And we have to ensure this by ensuring that we have a strong, motivated workforce, especially. And we saw during COVID with compassion fatigue and the mental strain that it had, that we were not prepared for our healthcare workers to undertake this. So those were some of my lessons that I think we could go forward strengthening.
Thank you for those insights. I think moving forward to the next question, how do you think healthcare systems can integrate innovative technologies and solutions, practices to build resilience and to adapt swiftly to emerging challenges?
So I think some of the lessons that we learned during COVID was digital health is what is coming to the forefront. It's something we need, not just during pandemics. It's something we need for universal health coverage to increase access and to increase care and quality care as well. And it is a form in which we can actually leverage. So as part of South Africa, we're using the NHI as one of the components and mechanism factors, but worldwide, it's a call where we need to use these innovative technologies. So telemedicine was one of the areas that came into the forefront in terms of trying to get access to care. We had mobile testing stations, which increased care. There were countries like Ghana, which used drones to pick up specimens because the turnaround time from the time a specimen was taken till it got to a lab and a result was output was a very long time because it required human capacity and access. And so use of apps as well also assisted with this by allowing us to inform patients of their results timeously. And then we also had a use of what we need to do and move towards is an integrated data system for interoperability as well as for big data analytics, because this is what we need in terms of research and to drive scientific-based outcomes. So I think those are some of the areas.
Build up on that, I think that the crisis accelerated the adoption of digital health solutions. However, telemedicine and video consultations, even if they emerged as tools that were really vital for maintaining healthcare access and reducing the infection risks, after the acute phase of the pandemic subsided, many health systems saw a decline and a reversion to pre-pandemic habits. With telehealth utilization declining. Now, this raises an important question. Are we prepared to sustain and integrate these innovations into routine care? Or will we just rebuild these systems from scratch during the next crisis? So I think that looking ahead, artificial intelligence offers transformative potential to strengthen pandemic preparedness and healthcare delivery. And AI can really there are several things that AI could provide. For instance, enhanced surveillance and prediction, streamlining resource allocation, but also accelerate research and development, but also supporting clinical decision-making. And I think these are really important topics to touch upon, but I think that we also need to learn from what we already had during the pandemic, that we saw a higher adoption and then it declined again. How can we avoid that for the next pandemic?
Right. And my third question is, what strategies and policies do you think are essential to make healthcare services affordable, equitable, and accessible, particularly in rural and underserved areas and communities?
I think equity must be at the very forefront of healthcare innovation, and rural and underserved communities must not be left behind in assessing advancements like AI and telehealth. Now, investments in digital infrastructure, such as reliable internet access and affordable devices, they are really critical to ensuring that everyone benefits from these technologies. So additionally, healthcare providers must also be trained to integrate these tools into their practice effectively. Now, international collaboration will also be essential here, as pandemics know no borders. And by sharing data, resources, and expertise globally, I think that we can mount a more coordinated and effective response to future threats. However, there are some things I would also like to highlight, and we must acknowledge and address the risks of algorithmic discrimination. So biases embedded in AI systems, such as those seen in the pulse oximetry devices, can exacerbate health disparities if left unchecked. So building AI systems that are fair, transparent, and rigorously validated across diverse populations is essential to ensuring that these tools are assets rather than liabilities, I think.
So I would definitely say that at the forefront, one of the main policy will be the universal health coverage, the health for all. We really need to drive that cube of increasing access, quality care, the standard of services, and having health care which does not cause financial catastrophe to those who are the most impoverished, the most vulnerable, and who actually need that. And whichever mechanism gets us there is the mechanism that we need to be there already. The pandemic just showed up the fact that there are still currently inequities, even where you have areas where they are attempting to get to that point. So I think from that point of view, we must have a whole of government and whole of society approach, because health is not confined within healthcare workers. It's an approach where we require the buy-in from all government sectors. We need intersectoral collaboration as well. It is a point where we need to put into health what we have, all the different components of that wheel. We saw during COVID, it was not just about non-pharmaceutical measures where you tell people to wash their hands, but they have no water to wash their hands. You tell people to isolate, but they're living in a crowded area. You stop healthcare services, and where do people go when you stop healthcare services because you're only looking at emergencies or you're trying to treat COVID cases? So you have to have that whole of sector, whole of society, whole of government approach. In addition to that, we have to leverage our primary healthcare. And primary healthcare, and looking at the Alma Ata and the declaration where we look at fostering what we have in South Africa, our district health model, and leveraging our community healthcare workers. So how do we upscale our community healthcare workers and our primary healthcare workforce to ensure that there are essential services and to ensure that we can actually get to our rural communities? So we saw this during COVID, especially within information as well. People within the urbanized areas where information was easily received, they were more likely to vaccinate, while people within the rural areas where they were not as, they did not have that access, or they were more open to misinformation or disinformation, were not going to vaccinate. And that carries on building on those inequities. So I think those are some of the implementation and strategies that we could work towards to actually move forward in pandemics or crises that occur in the future.
So additionally, I have a few more questions and would love to have your kind of very live thoughts on them. And then maybe a few rapid fire questions in our time ahead. Now, when we think of resilience, health has also unfortunately been a very laggard sector when we look at the climate conversation. Though climate and health are literally two sides of the same coin, and as WHO has said, that the climate emergency is a health emergency. Health is at the heart of climate, but for the longest time has been overlooked. So how do you think going forward can climate and health intersection and alignment be strengthened, especially from a resilience point of view, be it in terms of health systems, health infrastructure, supply chain, financial mobilization, and even One Health? Would love to hear your thoughts on that.
Okay, so I think that's very important. I think currently in South Africa, that's something we are currently seeing. We've been victims of flooding, wildfires, tornadoes most recently as well. And it is this there's different climate change which are causing an increase in infectious diseases in certain areas in, not necessarily in South Africa, but there's an increase in malaria. We've seen diarrheal diseases affecting children. We've seen after the floods that occurred on the east coast of South Africa, we saw an increase in E. coli infection. So what we need to do, and when we look at One Health and their triad between the environment and, as well as animals and people, we are all working in a symbiotic system together, and one will always affect the other. And therefore, we need to build resilient health systems, and this would also include early weather systems and warning systems as well. We also need to make and ensure that we have resilient communities. So it's important, again, to engage with communities, make them aware of this, aware of the different aspects of weather systems, as well as how to ensure that during the exorbitant heat that we experience or the flooding, and how can we actually build on that. Financing is always something that will drive it, and we need to ensure that we are on the agenda. So health is a whole of government approach, because we need to be within that conversation. We need to be there to say, well, we need funding. We need funding here because health is the one that is affected when all of these things happen. We also have the climate crisis, which are causing climate refugees now as well. So there's an overcrowding and urbanization and move to certain areas, which also talks to SDGs of the health and wellness and poverty. And so these are all interrelated. And so currently, we actually are looking to strengthen that in terms of working together, in terms of looking at health and looking at the climate crisis and how we can build resilient health systems, but also resilient communities who are aware. And this is done by our health promotion and enabling these communities and allowing for enabling environments, and also building public health policy to allow for that.
I think Dr. Singh said it very beautifully, so I have nothing to add here, except that I also think that there is a point to make in terms of the twin revolution that you also have now with AI coming and technology coming into this intersection. I think that can also provide some solutions, both for healthcare sector, but also for the climate crisis. So there might be like one solution that can help these two sectors at once.
Another question that I have is that how do you think healthcare resilience can be really mainstreamed, where not only public sector but also private sector engagement can be enhanced? Because as of now, mostly private sector looks at mitigation solutions, and adaptation and resilience is more of a public sector focus. How do you think that public-private sector engagement around healthcare resilience can be established more strongly?
So when we had COVID, and that was a lovely example of a public-private collaboration, because COVID was affecting everybody, and at that time our resources were limited. So we needed to leverage the private sector as well. We did this in terms of testing, because in the public sector, our testing capacity was not enough. So we worked with the private in order to assist with testing as well. And then in addition to that, it was our vaccine rollout as well. So here at this point, South Africa has a two-pronged system. You have your private and your public sector. Your public sector is about 80% and the private sector is 20%, but there's a larger number of healthcare workers within that sector. However, we worked together because once we received the vaccines, they were at a national level and they were rolled out in a phased approach as per the IHR regulations. And so we worked together with the private sector. And we also worked with the private sector in terms of hospitalizations and hospital beds and resources. So I think COVID provided an excellent example of how you can have a public-private environment where they can work together. Of course, and I must say this, with everything, there must be some kind of governance and oversight and monitoring and evaluation. Where in COVID, we worked in terms of having a centralized system for vaccination, and we were able to actually input that data. Now, when we worked with that in terms of working with big data, we need that private sector data as well. We need that data to map out diseases, to look at understanding what our burden of diseases are. And so it's very important that we have that and we leverage that further. And there is governance and there is oversight and transparency, because that builds public trust.
I also think that we don't we cannot wait for the next pandemic to have this sort of collaboration. We should continue and grow and foster this collaboration also in non-pre-pandemic times, right? So this is the critical lesson that we should take with us, that we also need to have this collaboration when there's no pandemic.
So thank you so much for your inputs. I think we've covered a lot of ground. And I think what's really come out is that resilience is, especially in healthcare, is not a retrospective, but has to be a prospective measure while designing and delivering healthcare solutions. It has to be at the heart of design and delivery. We've covered a whole range of things from critical lessons learned during the pandemic, to innovative solutions, to strategies, policies, climate and health intersection, as well as how we can foster greater public and private sector collaboration as well for healthcare resilience. So thank you so much once again, and I hope we can continue this conversation forward as well. Thank you.